Hi, I'm Sam Schmidt, and I'm a physical therapist at Alpine Physical Therapy here in Missoula, Montana. And for the past couple months, I've been working with Pamela Shanti Pack, and she's here with me today, and we are going to be talking about her rehab from one of her most recent injuries. She's a frequent flyer here at Alpine and comes back after doing her climbs, and we help her get back on track. So this last bout we've been working on is her low back injury, and she's going to be helping us understand kind of from a professional athlete's point of view how that rehab feels to her and some of the struggles and challenges and what she's gotten out of it.
My name is Pamela Shanti Pack, and I'm a professional rock climber and considered one of the world's authorities in my style of climbing, which is called off-width. It's an extremely aggressive style of climbing, very physically demanding, and I have been injured quite a few times. I've described the style as ultimate fighting with a rock in the past, which has sort of caught on in the industry. I think that's how people think of it now. And I have had multiple injuries. I've dislocated a rib, I've knocked out my front teeth, I've had some shoulder injuries, I've had fractured hands and fractured feet. I did some kidney damage and had to have 2 surgeries for that. It was really bad. And then I've had this repeating lower back injury. So I've done this in the past. The first one was a rather acute injury. I was on a very aggressive climb with a really dangerous sequence where I was potentially going to fall 150 feet. And rather than take that fall, I twisted my body into a position I knew was not a good idea. And I ruptured some discs on that first injury, and I came to Alpine PT, and it was a long process, but they put me back together. And this was also a similar injury. It was a little more chronic over time. I was having a lot of lower back pain and a lot of lower back tightness, and I figured I'd just sort of keep climbing until it incapacitated me. But yeah, I think what happened is that the chronic problems with muscle imbalances, I then was climbing and I felt the disc rupture midway through a climb and got off the route and immediately started looking for plane tickets to get back.
By far your most chronic low back injury, and it was, as we're finding out, not just your low back, not just the acute disc, but major muscle groups that have compromised and also compensated over the last year and a half, probably more. So we have hip issues and we have shoulder and back issues. As science has demonstrated, we know that if the core is not working effectively, supporting the spine, then a lot of the other muscles and joints are going to be less than 100%. And you have experienced that firsthand, and we have seen that. Let's just maybe talk a little bit about what you have been doing for your rehab. What does that entail as far as schedule, and what techniques do you feel have really helped you?
Well, with this particular injury, I figure a lot of the problem was that I had decided that I was going to climb for 6 months straight out of the year. And at the same time, I was also going to do Pilates instructor training. And it was a huge amount of impact to my body. But I have a high pain tolerance because of this style of climbing. You have to have a very high pain threshold. And I was able to ignore a lot of symptoms that I knew were very problematic. I was having a tremendous amount of lower back pain and stiffness that was radiating around my abdomen and into both of my hips. So I knew I was sort of setting myself up for a fairly bad back injury. But I thought that if I just climbed a little less and slept a little more, maybe it would kind of go away. When I got on this one particular climb, my back was really stiff before I even got on the climb. And when I got off the climb, I felt fine for about 10 minutes. And then just out of the blue, I felt like very nauseated and started having really bad radiating pain down my left leg and into the left side of my back. And I'm still really stubborn and had like a 50-pound backpack and was unwilling to give it to anybody. I'm like, I'm hiking out no matter what, this is cool. But partway through the hike, I was like, okay, somebody's going to have to carry my stuff for me. This is terrible. And I went back to my apartment and basically lay down and couldn't move for 2 weeks. I tried icing. I thought maybe it would just go away. But after 2 weeks, I realized not being able to stand at all or walk more than about a minute, that I was going to need to come back and have some fairly aggressive physical therapy if I ever wanted to climb again. And I actually contacted Sam and Leah, and Leah wrote me a stern letter saying if I wanted to climb again, I had to come home, or I could ignore it and be much worse off in 6 months. So I chose to come home. The therapy that we've been doing now is very hard for me at first, because I was going from climbing 6 to 8 hours a day to being virtually inactive. I couldn't move. Basically all we were doing was I was laying down and icing, and then just trying to activate core muscles that I didn't even know I had, and trying to restructure a bit. Because again, with back injuries, and other climbers have had them, we always think that the injury is just the discs. That, okay, I ruptured a disc and I have to just wait for that to heal. But in this case, there was a tremendous amount more involved in the injury that I wasn't so aware of. And so that's where we've begun, teaching me that there are muscles that need to activate to protect my spine.
So those deep core muscles, which core is used all over the place, but from a rehab and from a scientific point of view, we know that we need 3 muscles working efficiently and effectively. And those are the pelvic floor, the transverse abdominis, which are your deepest abdominal muscles, and your lumbar multifidi. In Pam's case, we were able to bring her in and use the real-time ultrasound, and that's a device that actually allows us to see whether these muscles are firing or not. And in Pam's case, her transverse was barely firing, and on her right side, it was almost non-existent, which would lead us to believe that yes, her spine is very unstable, and her pelvic floor was firing, but we were not seeing a natural co-contraction of the transverse, which is what you should see. And these deep core muscles should fire before you actually even move an arm or a leg, or you bend or extend. And for Pam, these were not happening. This natural preset of the core muscles were not happening. So her large global muscles, the large 6-pack abdominal muscle, the abdominal rectus, and her hip flexors and her back erector spinae muscles were all firing first, and that adds this just huge amount of compression on the spine and hence the disc. And so she was probably functioning using these big global muscles for 3-6 months, who knows, and that's when the disc finally ruptured at a certain point because of the amount of compressive forces. So a big part of what we've been working with on Pam is to release those big global muscles, and then getting her to concentrate on firing those deep core muscles, which are postural muscles that are kind of like trying to tap into a digestive muscle. I mean, it's something that should happen automatically.
So it's really challenging to go from being a very successful athlete who's ultra fit in my mind to discovering that you have a major weakness, something that you have no idea even exists, like the transverse abdominis. And going into the real-time ultrasound was incredibly useful for me, because I could actually see the muscles and I could see what was not working. And then learning how to activate those muscles, it's almost learning how, you feel like you're learning how to walk again. These are muscles that were apparently supposed to be working automatically. The first day I went in to do the ultrasound and they discovered that that transverse abdominis wasn't working, I was so frustrated, because I think of myself, like I said, as ultra fit, and I could not, for the life of me, get it to activate that day. They were very optimistic and encouraging, and they're like, it'll work. But I remember I went home that night and I was like, it's never going to work. But yeah, the real-time ultrasound has been super useful in seeing those, because when I went in and I thought I had activated it, And then there was proof on the screen that it did activate. I could go back and practice that at home, knowing I was actually working on the right muscle.
And you would do the real-time ultrasound once a week and then take that feedback and go home and practice, because it is a lot, like you said, that mental practice.
Yeah, so I would go to the ultrasound, I'd observe the process, and you guys would teach me with different cues how to activate those particular muscles that I couldn't use. And then I would immediately go home and practice for hours like a crazy person. And it was tremendously helpful.
Good.
And still is.
And then we also have done real-time ultrasound on Pam's hips, checking out the foundational muscles of the hip socket to see if they are firing first rather than her back extensors and her hip flexors. So we'll look a little bit more into that. But on the same point of bringing those core muscles on, we had to turn off the global muscles. And the most successful way we've been able to do that with Pam is by doing functional dry needling, where we actually take an acupuncture needle and go into the active trigger points of these large muscles, these global muscles that are doing too much because they're trying to stabilize the spine, and they just weren't designed to do that. They're really just compressing the spine. So in Pam's case, we've done a series pretty much once a week, sometimes twice a week, of dry needling to release those big global muscles so that she can more successfully tap into getting the right activation and timing of the core muscles first, and then the bigger global muscles. And what is your experience with the dry needling, Pam?
The dry needling has been tremendously useful for me, despite wishing it wasn't, because it is a painful process. But especially the dry needling in the TFL, it gave me a lot more range of motion in my hips, and now I actually really look forward to it, because a few hours or the next day after going through the dry needling process, the number one benefit I feel is this tremendous increase in my range of motion, and that really severe tightness seems to clear up for a couple days at least, and it seems to be more every time we do it. So at first it was 1 day, and then 2, and then 4. So I'm feeling like it's extremely useful.
Good, nice. And then on top of those things, we've built Pam's program to the point where she's incorporating a lot of Pilates-based exercises, and we have done that because she can do a lot of that lying down so that the spine is unloaded, and she's not having to work on holding herself up against gravity, but she can work on, are the core muscles firing, and are the global muscles coming in when they should be coming on. And she has a reformer at home that she's probably spends more than she wants to with. But over the course of the last 3 to 4 weeks, we've gotten her on a pretty extensive program using the reformer, and now we're just starting to get into some more functional training. And this will kind of wrap up the acute rehab stage where, you know, it's a lot of thinking, it's a lot of concentrating on what muscles are firing, what muscles aren't firing. And now through the ultrasound and also from Pam's symptoms, we're going to be going into the next phase of rehab, which is going to be more what athletes think they should be doing, which is in the gym and doing a little bit of the pre-plyometric, more functional pull-ups and sit-ups and more of the traditional training that Pam might have been doing in the past. But if she would have gone straight to that even 2 weeks ago, she would have been back where she was a month and a half ago as far as not being able to walk and probably not be able to tolerate sitting, that sort of thing. So at Alpine, we do work with a lot of high-level athletes and a lot of professional athletes that are world-class athletes. And some of the things that from a provider, somebody that's trying to get this athlete back to 110%, can be frustrating and or maybe a hurdle, is to really explain why that core activation is so important, and that really a lot of it comes from focus on getting the right muscles firing and not using the big global muscles. And that can take, you know, somewhere between 4 to 6 weeks of really intense work on the behalf of the athlete. And it's not their classic type of training. They're not sweating. You know, they're sitting there generally moving one limb and laying on their back trying to make sure that they have one element firing and one element that's not firing. But it's such an important part of getting that foundational strength so that they can continue to build off of that. And you know, back pain among athletes and among anybody really is really hard because it's not this visible limitation or disability in a lot of sense. It's not that you have this big, you know, shoulder brace around or sling, or that you're on crutches, or that you have a big cast on your foot. You know, you look pretty normal. It doesn't look like you're that injured. And so there's a huge psychological component to that, I think, that plays in anyone's rehab, that we have to try to make sure that they understand. Just because they look fine and they might be able to do some things, where that gradient is, where they properly need to train to get that foundation, to make those building steps so that they can get back to that high level performance.
Technology is not our enemy. It is a tool. When placed in the right hands, it can do amazing things. Innovations in medicine, along with well-established techniques, make for amazing results. That is why I established a team that utilizes the latest in physical therapy technology. Person of Interest, sponsored locally by Alpine Physical Therapy.
Welcome back, everyone. It's been about 2 months since Pamela's been in rehab, and the discussion that Pamela had with Sam regarding her injury and getting back to performance in sport. And with that in mind, I want to have an update from Pamela on how she's doing today, about 2 months into this.
Right, so I started rehab about 2 months ago, like you were saying, and that was really the very worst part of the injury because I was in the acute stage, and I figured the acute stage would last about a week, but the acute stage went on really for about 2 months. Now I'm in a rebuilding and strengthening phase, which is a vast improvement because I feel like I'm actually an athlete again and starting to train and have hope that I will be climbing again. In that first phase, the acute injury stage, I think for any athlete, you really question whether you'll ever recover, whether you will get back to your sport. But now I'm feeling good.
So you're seeing the light at the end of the tunnel.
I am. I mean, it's pretty far away still, but I'm actually feeling good, feeling stronger, and I felt just significant progress in the last 2 months. It's been every week.
You're feeling it in your body. Now you're moving into more of a strength rebuilding phase. What about getting back to sport? What are you feeling about that? Like how far out and that type of thing?
Well, I'm still trying not to actually think about that because if I start making plans, I get a little desperate and panicky. So I'm trying to think day by day. Really, I'm setting it in week increments and seeing how much progress I make in a week. But as of last week, I did start looking at routes again and making plans to go down to Utah and start looking at the climbs I want to do. And so yeah, now I'm getting ready to return to climbing. It'll be a few more months, and I'd imagine to rehabilitate the injury entirely will take quite a few months, but I'll be able to start climbing.
In conclusion, what's it like to be a world-class athlete with an injury that demands some rehab?
I don't think that for an athlete there's really much worse an experience than having an injury that could potentially end your career. And every time you have an injury that you think will end your career, it's really hard to confront it. But with you guys at Alpine, you've made the process, you give a lot of hope to the process, and you also make it seem possible. I mean, I didn't walk into Alpine expecting you guys to say you'll never climb again. I expected exactly what I got. I walked in and they said, this is going to be a lot of work. You're going to climb again. So.
Well, we appreciate the opportunity to work with you and help you through this, and appreciate you spending some time to help us with this video podcast. For more information, be sure to visit our climbing page on alpineptmissoula.com and also visit the resource section under health information. Thanks for joining us.